Hey everyone, Harrison Vaughn here, physical therapist, instructor for cervicogenic dizziness. This latest blog post, we talk about Muhammad's work in 2019 on how he and his colleagues combined two approaches to look at actually cervicogenic headache. And basically, these approaches were the snag approach for headache and also the rotational snag that is described further by Mulligan. Um, Interesting that they put together really three groups. There's one reason why I like to study because they looked at one randomized group with just the headache snag, the other group with the rotational snag, and then a combined approach. And I think most of us in the clinic probably find that combined approaches tend to work really well. And I think this works well for other conditions as well. But in this study in particular, they found that the combined approach had greater improvements in the headache impact test and also the neck disability index. And those are two functional scores that are associated that we tend to utilize for people with headaches and neck pain. Interesting enough, the authors also looked at the dizziness handicap inventory, or DHI, and the combined approach didn't really change that dramatically or significantly. And I found this interesting because I find that with dizziness and people are having dizziness potentially from a cervical involvement, there are lots of other moving parts. And it may be a little bit more complex than just the pathophysiology or cervicogenic headache. And so I always describe in our courses that we address not only the joints, but which is what the snag approaches directly, but also we look at some of these soft tissue points or uh, acupoints or fascial points, whichever wording you want to put it, that are high in muscle spindle activity. And maybe that needs to be addressed a little bit more. Or potentially, we need to look at also adding either vestibular rehab or vestibular rehab plus sensorimotor training for this type of group. And I think that's where you're going to find this combined approach that may be able to get you even more results in someone who is having dizziness other than just headache. So everything's written in this blog. Hope you enjoy it, and feel free to leave some comments. Thank you.